Begin our chair yoga class in a comfortable position with your legs uncrossed. Place your hands on your lap with your palms facing up for energy, down for stability. Either let your eyelids close or gaze down over the tip of your nose. Begin to relax. Begin to clear your mind. Become present in this space, in this time. Take a big breath in through your nose, fill all the way up. And then open mouth exhale, release through a sigh. Breathe in through your nose, fill your belly, your lungs, all the way to your throat, hold at the top. And then when you're ready, sigh it out, open mouth exhale. That's it, one more time, breathe in. Breathe out. And on your next inhale, seal your lips at the top. Hold the breath. And breathe out through your nose. And continue to breathe in through your nose and out through your nose. We call this Ujjayi Pranayama, your victorious breath. Nose breathing will help keep you calm and focused. It will help you to build and keep heat in your body as we begin to move through class. Let the rhythm of your breath be your guide today. Allow the focus on your breath to calm you. The energy that you're pulling in energize you. As you inhale, lift your shoulders up towards your ears in a nice shrugging motion. As you exhale, lower your shoulders down. That's it. Breathe in, lift your shoulders up. Breathe out, lower your shoulders down. Do this 2 more times at your own pace. Really pull your shoulders up towards your ears and then completely relax down. On your next inhale, lift your shoulders up. You exhale, if you can, roll your shoulders around, all the way back, and then down and back to where you started. As you inhale, lift up. Exhale, big shoulder roll back. Do it 2 more times, follow your breath. When you come back to where you started, breathe in, lift your shoulders up. As you exhale, roll your shoulders forward, around, all the way around, and back to where you started. Lift up, roll forward. 2 more times. And we'll meet back where you started. You inhale, lift your hands up, facing forward. Exhale, roll your wrists around in a circle. 2 or 3 times each way. When you finish going one way, reverse, go 2 or 3 times the other way. Then stop, shine your hands forward, spread your fingers as wide as you can spread them. You exhale, squeeze your hands shut tight in a little balls. Open, close. 2 more times, open, close. Then open your hands big and wide, face them toward each other, and bring your palms together to touch. Guide your thumbs into your heart center. Look down over your fingertips, close your eyes if you want. Set your intention for the rest of class, for the rest of the day and the days ahead. It can be a word, a phrase, a name, or a wish, anything that comes to mind. Our shared intention today, should you choose to add it to your own intention, is healing. Today we'll be focusing a little more on the upper body, specifically the shoulders. But wherever your body needs to find healing, there's anyone that you know who in particular needs extra healing energy today, we'll be sending that energy out. Let's feel our intentions together. Take a big breath in. Big breath out. Your eyes are closed, open them high. Release your hands by your sides, face your palms forward. Inhale, mountain pose, lift your arms up over your head. As you exhale, notice your feet, ground them into the floor below you. Then lift your fingertips just a little higher. Beautiful, take a breath in. Exhale, side bend to the right. Option to grab your left wrist with your right hand and pull up and over. That's it. Melt through the left side of your body as you reach toward the right side of the room. Allow yourself to open up as much as you can comfortably here. Inhale, mountain pose. Reach your hands back toward the sky above you. Exhale, side bend to the left. Option to grab your right wrist and pull. Remember throughout class today, do what feels best for you. If you need to modify or take a break, please do. Inhale, mountain pose, lift up. Exhale, baby back bend. Bend your elbows out to shoulder height like a goalpost. And lean back in your chair. Look up to the ceiling above you. Squeeze your elbows together behind you a little more. And inhale, mountain pose. Bring your shoulders back over your hips. Reach your arms up high. Exhale, forward fold. Bring your hands to heart center. Hinge at your hips. Bring your belly over your thighs. Relax your hands above your knees. You can slide your hands further down your legs. Do so. If you can touch your fingertips or your palms to the floor, go to where you're stable in your chair. Make sure you're safe and secure in your chair. Relax your head. Breathe in. Breathe out. And inhale, rise up to where you started. Exhale, relax your hands by your sides. Breathe in. Breathe out. Keep breathing. We're going to begin to flow, moving a little faster, linking our breath to each movement. You also have the option of standing. I'll stand up for the next round. You don't have to, but if you prefer to, you can stand. We're gonna do this little sequence 3 more times, seated or standing. Here we go. Inhale, mountain pose, lift your arms up. Exhale, side bend to the right. Inhale, mountain. Exhale, side bend to the left. Inhale, mountain. Exhale, baby back bend. Bend your elbows, lift your heart. Beautiful, Barbara. Inhale, mountain pose. Reach your arms up. Exhale, forward fold. Hinge at your hips. Bring your hands to wherever you're comfortable taking them. Breathe in. Breathe out. Inhale, rise up. Exhale, relax your hands by your sides. We flow through 2 more times, standing or seated. It's up to you. Inhale, mountain pose. Exhale, side bend. Inhale, mountain. Exhale, side bend. Inhale, mountain. Exhale, baby back bend. Inhale, mountain. Exhale, forward fold, bow down. Reach your hands to where they're most comfortable. Breathe in. Breathe out. Inhale, rise up. Exhale, relax your hands. 1 more time. Inhale, mountain pose. Exhale, side bend. Inhale, mountain. Exhale, side bend. Inhale, mountain. Exhale, baby back bend. Bend your elbows, look up. Inhale, mountain. Exhale, forward fold. Breathe in. Breathe out. And inhale, rise up. Exhale, relax your hands by your sides. Inhale, mountain pose, reach your arms up. This time, bring your palms together to touch above you. Exhale, pull your palms right into your heart center. Sit or stand nice and tall. As you inhale, lengthen your spine, grow a little taller. Exhale, prayer twist to the right. Rotate through your lower back, your spine, all the way up to your shoulders, your neck, your head, and your eyes. Breathe here, keep twisting. And inhale, face forward, come back to center. Exhale, prayer twist the other way. Again, rotate through your low back all the way through your spine, shoulders, neck, head, and eyes. Keep twisting, breathe in, breathe out. Then inhale, come back to center. Exhale, prayer twist to the right, but with a right knee lift. So if you're standing, see if you can do that as a little balance. And if you're seated, still work on the twist. Then inhale, come back to center. Your foot comes down to the ground. Exhale, prayer twist with a lifted left knee, other side. You won't hold as long. Breathe in. Then exhale, come back to center. Bring your left foot down. We'll do this one more time with the lift. Take a breath in. Exhale, twist, lift your right knee. Then inhale, come back to center, foot down. Exhale, twist, lift your left knee. Inhale, center. Exhale, relax your arms by your sides. Then if you're standing, you can try this standing, or you might want to sit down, just see how it works. Send your right foot up off the ground, lift it, and then straighten it straight out. So if you're standing, you're gonna have to balance here. You might have to hold on to your chair or sit down. Okay, send your right foot out, take a breath in, exhale, point your toes forward. Lift and point, lift and point. That's it. If you need to bend your leg a little more, you can. If you need to set your foot down, no worries. 2 more times. Lift and point. And lift your toes up to the sky. As you inhale, lower your heel toward the ground. As you exhale, lift up. So if you're still standing, you just lower and lift, lower and lift. Keep breathing. That's it, Nancy. Nice. You're here for 4, 3. You got it, Gisette. 2. Last one, lift and hold. Hold with me for 4, 3, 2, and 1. Release your foot down. And as you inhale, lift your left foot up off the ground. As you exhale, extend it forward. Pull your toes back towards your nose. Breathe in. Then exhale, point and stretch. Lift and point. There you go. You got it. Anything ever hurt? You feel a sharp pain, come out of it. Be gentle. We're healing today, so if anything needs special love or attention, you send your breath there. We're here for 4, 3, last 2, last 1. Point your toes up. As you inhale, lower your heel toward the ground. As you exhale, lift, lower, and lift. And if you're standing, you can balance or hold on to your chair. Lift. That's it. You got it. 4, 3, last 2, last 1. Hold for 4, 3. Nice work. 2, 1. Relax your foot down. Breathe in and breathe out. And take a breath in. As you exhale, drop your chin down towards your chest. Notice how you feel in your upper neck here before we move on. Stretch the back of your neck as you look down. And inhale, lift your head up. Exhale, dip your head back. Guide your chin toward the ceiling. Nice and gentle on your neck. Opening up through the energy center right in the middle of your throat. Inhale, lift your head up. Exhale, bring your right ear down toward your right shoulder. You can do more of these later if it feels good. If you slept a little funny and you have undo a kink in your neck, hold these for a little while longer later. And inhale, lift your head up. Exhale, left ear to left shoulder. Stretching the right side of your neck, that's it. Then lift your head up. Face your palms forward. And then guide your 2 pinky fingers forward. So your thumbs are going kind of to the wall behind you and your pinky fingers are forward. You have to externally rotate through your arms like that. Then inhale, big windmill, lift your arms out like a T, up over your head, palms to touch, hands to your heart. If this is hard for you to do on one side, just do one arm. Lift all the way up. If you can, bring your palms together. Bring your hands right into your heart center so your thumbs touch your body. Lower, lift. Option to look up at your hands and then pull them down into your heart center. Do that 3 more times. Lower, lift. Option to look up, hands to your heart. Follow your breath 2 more times. You got it. 1 more. Pull your hands into your heart center. Relax your hands down. Breathe in. Breathe out. Beautiful. Inhale, reach your arms up out to your sides like a T shape. And as you exhale, face your palm forward and continue to breathe as you just push your hand forward and back, maybe like 2 or 3 inches. So you're pulsing here. That's it. Sending your energy forward, starting to warm up your shoulders just a little more, working into your arms. You've got it. Good. We're almost there. 4, 3, 2, 1. Stop, flip your palms down toward the ground below. Take a breath in. Exhale, warrior 2 pose. Keep your right foot where it is if you're seated and send your left leg out. If you're standing, rotate your right foot toward the right side of the room, bend your knee, and then send your left foot out. Okay, seated or standing, whichever you prefer, take a breath in. Exhale, extended side angle. Bring your right forearm to your right thigh. Lift your left arm up. Okay. Option to look up at your hand. Option to stretch your right arm down a little further. Good. Inhale, reverse warrior. Switch out your arms. Keep your legs as they are. Lift your right arm up and back. Your left arm comes to your left leg. Breathe. Inhale, warrior 2 pose. Reach your arms out to your sides. Then exhale. Stretch your fingertips a little further apart. Good. Inhale, star pose. Bring your arms up like a V. Send your legs out like a V. Straighten your arms and legs. Feel the energy through your fingertips and your toes. Breathe in. Exhale, goddess pose. Bend your elbows and bend your knees. Bring your feet to the ground if you're seated. If you're standing, just bend down. Great, take your breath in. Exhale, twist to the right. Inhale, center. Exhale, twist to the left. Take it 1 more time each side. Inhale, center. Exhale, twist. You got this, Regina. Inhale, center. Exhale, twist. Inhale, back to your goddess pose, nice and strong. Then inhale, star pose. Straighten your arms and legs. If you're seated, you bring your heels out. Exhale, warrior 2. That's it. Inhale, reverse warrior. Your right arm lifts up and back. Exhale, bring your hands together. Walk your feet together. Rest your hands by your side. Breathe in. Breathe out. Let's do the other side. Inhale, lift your arms out to your sides like airplane wings. Then as you exhale, flip your palms up toward the sky and pulse. 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 Starting to build a little heat in our bodies here. I hope you can feel it. If you need to release your arms down to your sides at any time, do so. We're almost there. Just 8, 7, 6, 5. Yeah, Mary. Last 3, 2, 1. Flip your palms down. And inhale, warrior 2 pose the other side. If you're seated, send your right leg out. If you're standing, rotate your left toes toward the left side of the room. Breathe here. That's it, Barbara. Take a breath in. Exhale, extended side angle. Bring your left arm to your left thigh. Reach your right arm up. Option to stretch a little more. If you're seated, it's the same. All right. Nice job. Inhale, reverse warrior. Keep your legs as they are. Lift your left arm up and back. That's it. You can look down at your back foot, up at your hand, or straight ahead. Take a breath in. Exhale, warrior two. Stretch your fingers, equal and opposite, side to side here. Nice. Inhale, star pose. Lift your arms up. Heels in, toes out. Exhale, goddess pose. Bend your elbows and your knees. Breathe in. Then exhale, flip your palms toward the back of the room if you can. See how that feels on your shoulders. Inhale, palms up. Exhale, palms down, fingertips toward the ground. 2 more times if you can. Lift up, and then press down. Good. Come back to your goddess pose. Strong, positive. Inhale, star pose. Big X shape with your body. Exhale, warrior two. Inhale, reverse warrior. Lift your left arm up and back. And exhale, bring your hands, your feet together to touch. Rest your arms down. We'll do that one more time on each side. We'll eliminate the arm pulses. So just flow, following your breath, go at your own pace. Inhale, warrior two, seated or standing. Exhale, extended side angle. Inhale, reverse warrior. Exhale, warrior two. Inhale, star pose. Exhale, goddess pose. Inhale, star. Exhale, warrior two. Inhale, reverse warrior. Exhale, bring your hands, your feet together, hands down by your side. One more side to go. Inhale, warrior two. Exhale, extended side angle. Inhale, reverse warrior. Exhale, warrior two. Inhale, star pose. Exhale, goddess. That's it, Robin. Inhale, star. Exhale, warrior two. Inhale, reverse warrior. Exhale, hands and feet together. Hands by your sides. Breathe in and breathe out. One more cleansing breath on your own. Big breath in. When you're ready, big breath out. All right, whether you're seated or standing, bring your legs out like a V shape. If you're standing, you're like this. If you're seated, just make as big of a V shape as feels comfortable for you. You can make it smaller. You can even have a little bend in your knees if you need to. And bring your hands to your hips. Gently press your hands down into your upper thighs just to feel your spine lengthening a little bit. And take a breath in. Exhale, side bend over to the right, and then start to rotate your body in a circle. Come to the right corner of the room, bring your belly over the ground, in the left corner of the room, take a nice little side bend, come back to where you started, and do this one more time. Gently rotate through your low back, stretching through your legs. And we'll meet back to where we started. Take a breath in. Again, press your hands into your legs, lengthen your spine. And exhale, side bend to the left. Keep breathing as you just take a nice full body roll. Join your belly over the ground. If you're in your chair, just stay secure in it as you move forward. Right. Come back to where you started. Come around again. Go that way. And let's take one more on this side. Just come around nice and smooth. You can exaggerate it as much as you want or modify it so it's less of a circle. And come back up. Gently press your hands into your thighs. Breathe in. And slide your feet back together in front of you. Release your hands from your hips. If you have something to pick up today for extra weights, you have weights or bottles or cans, anything, Grab those now. They're optional, so if you don't have anything, that's okay. We'll start with our palms up to the sky, guiding your elbows into your side body at a 90-degree angle. You don't have the weights, your hands are just in front of you, elbows tucked in, breathe in. And exhale, separate your hands away from each other so they go toward right, left, east, west, each side of the room. And pull them together and open, close, and open. You might experiment here as you pull your hands toward each other to cross and see how that feels. You're going to exert just a little more across your back and upper shoulder muscles. Nice and gentle for 10, 9, 8, 7, 6, 5, 4, 3, last 2, last 1. And bring your hands back toward each other, but flip your hands so they're facing each other. You're holding weights or bottles, they look like columns up and down. Lower your hands to frame your legs. Breathe in and exhale, hammer curl up toward your shoulders, strengthening your biceps. So it's lower and squeeze up. You got that? It's bend, extend down. The bicep is also connected to the shoulder, so strengthening that muscle helps us support our shoulders. Breathe. Exhale as you squeeze up. If you have nothing in your hands, just squeeze a little harder. You got it. Nice work. It's 10, 9, 8, 7, 6, 5, 4, 3, 2, last 1. Lower your hands down and face your hands toward the wall behind you. Straighten your arms, lean your belly over your thighs. You can do this standing too. So you're leaning forward slightly. We're gonna take a narrow row. Take a breath in and then row your hands up towards your armpits. Lower and lift. If you find the weight is too much or sitting in the chair is uncomfortable on your back as you're lifting, you can lower the weights, or if you're able to stand up, you'll take a little bit of the pressure off your low back. So it's up to you. Just see how it feels. We're rowing up. Lift. Lift. Actually, these are more of a wide row than a narrow row because we're pulling our arms out wide. We'll do the narrow row next so I can show you the difference. You're here for 8, 7, 6, 5, 4, 3, last 2, last 1, lower down. This time, face your hands toward each other, but you're still leaning your belly slightly over your thighs, whether you're standing or seated. Take a breath in. Now this is a narrow row. You're pulling your elbows in and then down. So the other one, your elbows were going out wide. Here they're making less of a footprint here, coming right up into your side body. That's it. Squeeze. You got it? That's it, Mary. Looks good. Breathe. Breathe. That's it. Let's do 10, 9, 8, last 7, 6, squeeze in 5. That's it, just that. You got it. 4, last 3, last 2, last 1, lower, and then sit upright. We're gonna do these 4 different exercises that we just did. We're gonna do them all again. So flip your hands up to the sky, tuck your elbows in tight. Pull your hands in toward each other, breathe in. Exhale, open and close. Open and close. Breathe. Stay with me here for 10, 9, 8, you got it, 7, 6, 5, 4, 3, hammer curls in 2, and 1. Close them up, face your hands toward each other. Lower your hands down, breathe in. Exhale, hammer curl up and down. Lift and lower. You got it. We're building strength. Weight bearing is good for us. Good for osteoporosis. Good for lifting the groceries. We've got this. 10, 9, 8, 7, 6, 5, 4, 3, wide rows in 2, and 1. Lower your hands down, face your palms toward the wall behind you, lean forward, breathe in. Exhale, wide row up, elbows go out, sit down, and lift. Down, and lift. Follow your breath. Stay strong for 10, 9, 8, 7, 6, 5, last 4, 3, narrow rows and we're done in 2. Last 1, lower down, face your hands toward each other, breathe in, then squeeze up. So hands face each other. It's a narrow row, elbows are going back. That's it. Yeah, Mary, you got it. Squeeze, squeeze. Make these good, nice and controlled. Lean forward slightly. 10, 9, 8, 7, 6, 5, last 4, 3, 2, and 1. Lower down, sit up. If you have a table to put your weights on or your bottles, put it there. If not, set it on the floor. If you want to take a sip of water, feel free. You're always welcome and encouraged to hydrate through class. Cheers. When you're ready, let's stretch. Send your right arm straight out forward at shoulder height. Guide it across your body till your hand meets your opposite shoulder and your elbow bends. Option to take your opposite hand to stretch. And then also option to send your hand out, arms straight toward the opposite wall to get a little more of a shoulder stretch. So either way, elbow bent might take a little pressure off the shoulder, a little more of a shoulder stretch, arms straight. Good. Then release that grip if you have it. Guide your elbow up to the sky. If that is impossible or hurts you right now, you can just massage your tricep. Otherwise, option to take your opposite hand and give yourself a nice little stretch. See what you got. When you're ready, release your elbow, send your arms straight out with your palm up. Tip your fingers toward the ground to stretch through your arm. That might feel great, just like that. If you want to get a little extra love, take your other hand, maybe gently massage through your wrist, your forearm, your bicep, triceps, all the way up to your shoulder. Give the shoulder a little love. Touch is important. And then flip your palm down, relax your hand to your side. Take your left arm, lift it up at shoulder height, palm down. Trace your hand across the room, across your body. Start to bend your elbow, bring your hand to your opposite shoulder, and use your other hand to stretch. You want more of a stretch across your shoulder. You can straighten your arm out across your body. See how there's a little difference? Maybe see how it feels, and then you pick the choice that works best for you. Hold it a couple more breaths. And lift your elbow up to the sky if you can. Stretch your tricep. If you don't have that mobility in your shoulder here, You can just give yourself a little massage with your arm down. Take what you need here. When you're ready, release your elbows, send your arms straight out with your palm up. Dip your fingers down toward the ground. For extra attention, take your hand, opposite hand to your wrist, forearm, bicep, tricep, shoulder. Then flip your palm down, relax both hands to your side. Take a shoulder roll back. See how this one feels compared to the first one you did. Shoulder roll forward, same thing, no judging, just be aware of how you're feeling in your body. So a lot about yoga is slowing down, feeling your breath coming through your body, feeling where you need to release tension. Breathe in, breathe out. And inhale, lift your arms up over your head. Exhale, eagle pose on the right. Sweep your right arm under your left arm. Cross once. If you want, stop here and grab your shoulders, or you want to cross twice, bring your hands together. It's up to you. And lift your right leg up, cross your right leg over your left. If you want a balance challenge, you can stand up, maybe use your toe as a kickstand, or lift it, maybe bring it behind your opposite calf. Breathe here. And take a breath in. Exhale, fold forward, bring your elbows towards your thigh. Lift and bend. Easier if you're seated or if your toes down. And forward, lift up, keep going. Do this 4 more times, working through your abdominals. 3. Last 2. Last 1, sit upright, squeeze tight, breathe in. Exhale, uncross your arms, unwind your legs. Inhale, mountain pose, lift up. Exhale, eagle on the left side, sweep your left arm under your right. Option for the 1 cross or 2. Lift your left leg over your right. Standing, same thing, bend into your standing leg, maybe your foot comes all the way around. Breathe in. Exhale, fold forward. Lift and fold. You got it. Nice, Barbara. Keep breathing. You got it. Keep going. 4 more. 3. Last 2. Last 1. Sit upright or stand upright. Squeeze tight. Breathe in. Exhale. Unfold your arms. Unwind your legs. Breathe in. And breathe out. Inhale, mountain pose. Bring your palms together to touch. Exhale, hands to heart center. Inhale, tree pose. Lift your right foot up. If you're seated, you can cross it over or extend your left leg and bring your foot to the inside of your leg. If you're standing, bring your toe down to the ground for balance or lift it up into your left leg. Maybe use your hands to get a little higher. Use your chair for support. Breathe here. Option to send your arms up over your head. Take any shape you want. Grow a little taller. Breathe in. And whenever you're ready, you don't have to come out right away. Then exhale, bring your foot to the ground, bring your hands to your heart. If you're really feeling like you're balancing and feeling good, you can always stay in it. We'll do the other side. Lift your left leg up as you breathe in. As you exhale, stabilize by pushing your right foot into the ground. If you're seated, a seated tree pose can have one leg crossed, or send your right leg long and press your left foot in. So any way you feel comfortable, start to meditate here. Option to lift your arms. Take any tree shape that works for you. Breathe. That's it. If you want to stay in it, stay in it. Otherwise, grow a little taller. Take a breath in. Maybe look up. Exhale, hands together, feet together. Breathe in. Breathe out. Relax your hands. by your sides. If you're standing up, go ahead and sit down. We're going to relax now for the next few minutes. Close your eyes, or let your gaze be soft and look down. Relax your whole face, your cheeks, your jaw. Let your tongue fall to the bottom part of your mouth. Relax your neck. Relax your shoulders. From your shoulders to your fingertips, completely relax. Rest your hands on your lap. Palms face up to absorb all the beautiful energy you just created around you. Relax across your heart and your lungs. Relax your belly. From your hips all the way down to your toes, completely relax. From the top of your neck all the way to the last bone in your spinal column, relax. Relax across your hips. Relax the whole front side of your body and the whole back side of your body. Just find peace and presence for the next minute. Just be, and I'll let you know when it's time to move on. Please begin to awaken by gently moving your head side to side, up and down. Wiggle your fingers, move your toes. And then when you're ready, lift your arms up over your head, stretch them any way you want. Take a big breath in. Exhale, bring your hands together at your heart center. Look over your fingertips or close your eyes. Remember the intention that you set at the beginning of class. Our shared intention was healing, wherever that healing is needed. Let's take a unified breath together. Let all the air out until you're fully empty. Breathe in, lift your chest up into your hands, and breathe out. Then take a slight bow forward as you honor yourself for the hard work that you put into your class, to the focus and attention you gave yourself today. The word namaste in Sanskrit literally means I bow to you. It's a sign of honor, respect, and gratitude. And then as we bow to each other now, if you like, you can say that word together, namaste. Namaste, and thank you ever so much. At this time, we have a special guest. Thank you for being here today, all of you, and especially want to thank Dr. Jack Gossard. Dr. Gossard is an orthopedic surgeon who practiced for many years in Lafayette, Indiana, where I grew up, and is now in Boulder, Colorado. Is a wonderful, generous human being, as well as a wonderful doctor. So we're really honored and grateful for your presence today, Dr. Gossard. I'm going to put myself on mute. And if you can go ahead and unmute yourself. We'll allow you to say a few words today about our topic of the day, answer a few questions. And if anyone needs to leave, I will be recording this session and you can listen to it later. But with much gratitude, thank you, Dr. Gossard.
Well, thank you very much, Julie, and hello to everyone. It's nice to be here. Julie asked me to talk about shoulder impingement syndrome. And what I would like to do would be to recommend several videos that you can pull up on your computer. One of these is by Dr. Nabil Ibrahim, and it's Shoulder Impingement Syndrome, Everything You Need to Know. The other video, which I think is good, is by a Dr. Rich Hawkins. Excuse me. I would recommend that you use the pause button frequently while you watch these videos so you can linger on a picture and maybe better understand it. So the crux of the problem is impingement. Impingement means that something bumps up against something else, and this causes pain. And the impingement in the shoulder impingement syndrome is the, I'll use my hand here. This is the top of what is called the acromion bone. It comes up over the top of the shoulder and you can feel it up here. It is up above the ball, which fits into the socket. This bump on my hand here would be called the greater tuberosity of the head of the humerus. When you raise your arm up in the air like this, as the ball rotates and the shoulder and the arm begins to come up, the greater tuberosity rubs up against the underneath side of the acromion. And that's what causes the pain, and that's where they get the word impingement syndrome. Now, when your arms are down to your side, you're working and lifting, usually there's no trouble with the shoulder. And the impingement syndrome is very common. Apparently about 50% of all shoulder pain is due to this impingement syndrome. There is what's called a painful arc, as you can imagine, and it goes from about this point, elevation up to this point, and you can imagine in your mind's eye, this is where the greater tuberosity with the structures that attach to it rub up against the acromion. Once the shoulder gets up higher, that area falls down below and no longer impinges. So the crux of the solution to it is to perhaps increase the distance between the greater tuberosity and the acromion and depress the ball so that it doesn't rub. That brings us to the scapula. You can imagine what the scapula is. It's the shoulder blade. It rolls around the backside of your rib cage, and to the scapula is attached in the front, of course, is the socket. Now, the shoulder joint is not exactly like a ball and socket joint like the hip joint is. The hip joint has a deep socket and the ball fits into the socket and the hip rolls around. The shoulder, differently, is a very shallow joint. If you look at the bony part of the shoulder joint, it's rather flat, and the ball doesn't fit exactly like a ball and socket would. The ball circumference is smaller. So you can imagine that the shoulder joint is a rather skittish joint. It is the joint with the most mobility in our body. And when you have a lot of mobility, you give up stability. So the crux of the problem is, well, how does the ball fit into the socket in a stable way so that it can be elevated? The answer is two sets of muscles. One is the rotator cuff muscles. There are mainly three of them. And the other is not a set, it's the large deltoid muscle, which you can feel on the outer side of your shoulder. It's a very large muscle, very powerful. So what do the rotator cuff muscles do? Well, just like it says, they rotate. They rotate the ball firmly against the socket so that with that stability that is given by the rotator cuff muscles, the large deltoid power lifter can then raise the arm up in the air. If you look at where the rotator cuff muscles are, and I said there are three, there's one in front, one on the top of the ball that hooks into the greater tuberosity, and then one on the back side. The front is called the subscapularis. The top one that attaches here is called the supraspinatus, and the one on the back side is the infraspinatus. If you look at the vector pole of these three rotator cuff muscles and their tendinous attachments, they tend to depress the head of the humerus into the ball, and because there are three, they fix the ball in a stable position to allow the deltoid then to lift. Let's say you didn't have the rotator cuff muscles. All you had was a deltoid. You had a total tear of all the rotator cuff muscles. The pull of the deltoid would then be such as to simply pull the ball up into the top of the acromion, and the arm would not come up in the air. So let me go on here. I'll see if I can show you this. Are you able to see this picture I'm holding up here? I'll just go to this one picture in front. This is a front drawing of the shoulder. This is the ball. The socket would be in behind here. The front muscle is the subscapularis. The top muscle is the supraspinatus. On the back side is the infraspinatus. And you can see how they encircle the head. Now here's the acromion that comes up on the top. And you can see how when the arm would be raised up in the air, that this area here would rub up underneath here. So how does a doctor make a diagnosis? Well, he asks about where your pain is. And as I said, it's usually in this painful arc that we talk about. There is a tender point that is right where the supraspinatus attaches to the greater tuberosity. It's about here. If you have it, you can probably find this point. There's a tender point right here. There are some tests that he does. For example, one test is he will hold your arm in a position like this and roll it this way. And what that does, you can see in your mind's eye, it rolls the greater tuberosity against the acromion. That causes the pain. That's it. One good thing that he does to both diagnose it and to treat it is to give an injection. And the injection usually is some local anesthetic and a steroid. I know when I used to give injections, I would find where that tender point was between the acromion and the head of the humerus, and make a little dent in the skin with my finger, and then of course rub it off with alcohol, and try to get that needle in that space between the acromion and the top of the humeral head. There are actually three structures that can be painful there. There's the attachment of the supraspinatus. There's a bursa, which is in that area on top. And then there's also the biceps tendon, which is going down in front. Any of these three structures can be painful, and it's a little difficult to tell exactly which one it is. But if the injection goes into the right spot, all the pain goes away rather quickly. You say, well, that's what the problem is. And then also the cortisone can have a long-acting effect and could be a treatment for this because it's an anti-inflammatory medicine. On x-rays, many times the x-ray doesn't show anything, but occasionally it will show a bone spur, which is on the underneath side of the acromion. And if this is of significance, an operation can be done, usually by a shoulder specialist, in which they put a scope in, and basically they simply rub off and remove that bony spur and give more space on the underneath side of the acromion. Getting to treatment, as far as physical therapy, there are some exercises. You can look on different videos. Some of these exercises are complicated, and in general, I would not do any exercise that causes pain. what you want to do in an exercise program is to avoid pain, but to strengthen the muscles, the rotator cuff muscles, which help to depress the head and increase that space that we're talking about. So I would talk about just two simple exercises. One would be, you can see this with using the TheraBand rubber band exercisers. You can hold the TheraBand this way and rotate the arm inward. That would strengthen the subscapularis muscle, which pulls from the front. And then you can reverse the rubber band so you're in this position and you are pulling the arm outward. You can see that would strengthen the infraspinatus muscle on the backside, and that would make these muscles stronger so that they can do their job of pulling the humeral head in. You do this exercise with your arm down to your side. You wouldn't want to do it with your arm up high where there would be rubbing of that impingement. So you do the exercise down to your side. You can do maybe 10 reps of each. Those are good. You can look on the videos to see that what some of the other exercises you might do that would be helpful. If you have a problem with motion, there is a good exercise called a pendulum exercise. And it's what the word implies. Usually to do this exercise, a person goes to the kitchen table. If I were going to exercise my right shoulder, you would put the left hand down on the edge of the table, bend forward at the waist, and you rest your forehead on your hand so that your right arm would be hanging down at 90 degrees. You let it relax. You have a small weight in your hand, and then you can go back and forth nice and easy in this plane, maybe 10 reps. You can go up and down 10 reps, and then you can go around in a circle one way and then around in a circle the other way. And these pendulum exercises, again, done without pain, but they can be, you can imagine that the swings can be gradually increased in direction as you get more motion in the shoulder. And then when the shoulder gets to be in better condition, these exercises can be gradually increased into more strengthening exercises. I think that's sort of the crux of it. These videos will, I think, will be helpful, and I hope this has helped to maybe help you get a better picture of what the videos will show.
Dr. Gossard, thank you so much. That was very informative, very helpful. I'm even going to listen back to this video later so I can absorb everything that you said. At this time, if anyone has a question, you can unmute and ask the question. If I may, I'll start with one.
Sure.
Regarding the rotator cuff, well, first of all, how do you diagnose the tear? And then if you have a tear or multiple tears, what are the options for the best recovery?
Yeah. Many times it's difficult to tell if there is a tear or not. You can imagine, and tears almost always begin at the insertion of the supraspinatus tendon, which is on the top that goes into the greater tuberosity, because that's where the friction and motion occurs and wear occurs. So the tears almost always happen that way. I think there can be two kinds of tears. One can be, for example, in a bad fall that you have, and you can imagine it could be a massive tear where a good bit of the rotator cuff falls off. Usually these occur in older people, but wear and tear by itself, of course, can cause a small tear. So the very large tears that are acute, those are best repaired surgically. And I think if you do go to a doctor, you should go to a shoulder specialist who does a lot of these. If it is a small tear, then it becomes more a question of, well, can this be treated? Can it be helped by simple measures like exercises, rest, injections, and that kind of thing, so that a person gets along okay with it? I would say the good news about this kind of problem in not a severe situation is many times it gets better. Many of these orthopedic problems, bursitis, tendonitis, arthritis, they go along for a while and they're a bother, and then they begin to get better. And so that is the good news. Certainly not all of these need an operation. But to diagnose them, probably, to be sure, you would maybe need an MRI that would show exactly what the anatomic problem would be. One thing I might mention about a rotator cuff, and maybe the reason they can have a tendency to get better, is I imagine it like there would be a horse and buggy, and you would have 4 reins on going to the horse to control it. If you had one rein or even 2 of these reins broken, we'll say, the other reins can tend to take up the slack, so to speak. And a person can accommodate their activities, what they want to do to allow it to work better. That's good news.
All right, thank
Other
you.
questions?
Yeah, other questions?
Jack, what do you think of multiple cortisone shots? I've had one, which worked for about 3 weeks, and still have the pain. So do you recommend trying another?
Yeah, I think about injections in general, usually they say maybe try up to 3 injections. That's in general for this condition, a lot of different conditions. If it hasn't worked at 3 tries, maybe it's not going to work then, but certainly another injection at some point would be worthwhile.
Okay.
And
And also, is it usual to have bicep pain in the bicep relating to the shoulder?
now you're talking about the bicep down low, the muscle?
Well, I don't know, maybe I'm talking about the wrong muscle along here,
Well, let's see.
or the
Now,
upper arm.
yeah, the deltoid muscle, the big deltoid here, it's really big. It attaches on the spine, the scapula, around the acromion and the clavicle in front, and it goes down and it inserts about right here. It's not uncommon that pain from up above will be referred down to a lower location, when in fact there's nothing wrong really at that spot. It's where the pain is referred to. But now that's the deltoid, that's the large deltoid muscle. The biceps muscle, of course, is in front here. And what's called the long head of the bicep attaches above the socket, goes down across the ball, actually between the subscapularis and the infraspinatus in front. It is right in this area too, where when you raise your arm up, you can, it will irritate that tendon. So as I said, there are 3 structures here. It's a little difficult, certainly by palpation, to tell which is the problem.
Sure.
Yeah.
So that could be a problem. That
Yeah.
could have caused it. You're saying.
Yeah, it could be the biceps tendon, but again, a cortisone injection hopefully would be in the spot that it might do some good there.
Okay, good, thank you.
Sure.
I have a question. The first MD's video that you mentioned, I got the second one, Rich Hawkins. Could
Yes.
you spell the name of the first
Yeah,
person?
the first name is Nabil, Nabil, and his last name is Ibrahim,
Oh, okay.
Ebrahim.
Thank you.
He's got a series of a number of videos. He's got videos on rotator cuff tears, frozen shoulders, probably biceps tendonitis, I can imagine. And he speaks with a bit of an accent. So you have to hit the pause button frequently. And you can linger on a picture that he's got up and look at the muscles and et cetera. But he gives a very, very nice talk about this. And most of his talks are 8 to 10 minutes long and pretty easy to watch.
Thank you.
He's been very
Great.
helpful. Yeah.
Any other questions?
Yeah, I have one.
Yes.
I have one. About 2 years ago, a little over 2 years ago, I had an AC joint surgery by a shoulder specialist, a chromoclavicular surgery. I believe they went in and took off some spurs and just basically cleaned up some things. It's much better than it was. It's still, I can't lie on that side for a long period of time. Is that normal that far out?
It might not be uncommon to have some residual symptoms. You say it was an AC joint problem.
Mhm.
The clavicle, the collarbone goes out and it attaches to the acromion.
Right.
And it can develop some arthritic changes in it. Probably what he did, I know I didn't do arthroscopy, but I did some of that surgery. You simply take out about a quarter or 3/8 of an inch of the end of the clavicle, so that where they used to rub, then you've taken that part out and they no longer rub. But it's not uncommon that there are some residual symptoms there.
Well,
Usually that was the kind of pain that if you would pull your arm across the front of your body, it would be painful.
Or
because-
back for a
that's
seat
right.
belt,
It
impossible.
force that joint together. Right.
Do you think we'll just give it a few more years, or?
I'd give it time.
Yeah.
Give it time. Yeah. And it may be, if you say it hurts when you lay on that side. Yeah. If you could avoid that, at least for a while, maybe that will get better. In general, for these things, especially the impingement syndrome in the beginning, if you want to try to avoid doing those things which are painful, it sort of sets up a cycle of pain and motion.
Okay.
Mhm.
Thank you.
Any other questions?
I'll make an email you if I have questions.
That was very helpful though, Jack. Thank you.
Yeah.
Really,
Good.
really interesting. And I
Yeah,
look
thank
forward
you
to
very
watching the
much.
videos.
Right. I think you'll enjoy them. They're very good.
Great.
Okay.
Thank you.
Good.
Well,
You're
thank you
welcome.
so much, Dr.
Enjoyed
Gossard.
it.
Thank you, everyone, for being here together today. And if you have any other questions that come up, or comments, or other topics that you'd like to discuss in the future, please contact me, and we'll see what we can do. I hope everyone has a great day.
Thank you.
All
Thank
right.
you.
Thank
Bye-bye.
you.
Bye.
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 Thanks, Julie.
Thanks, Julie.
Yeah.
Wonderful.
Thank you very much.
Bye-bye.